This presentation will be talking about accessing and interpreting health data from online data sources. The course objectives include applying descriptive techniques that are used to summarize public health data, as well as applying informatics techniques for vital health statistics and other health records. Some student outcomes include accessing and interpreting these vital statistics and public records from the internet. Some online sources for data access include free public access sources that are used by health professionals, including educators, administrators, health educators, as well as a number of other people. And this helps to identify disease and risk factor prevalence and incidence rates. These rates help us to provide rationale for creating and implementing a number of policy and program interventions, or to help with our priority setting and allocation of resources, monetary resources, staffing resources, and those types of things within our community or organization. So this is the online sources for data access. The first one we'll talk about is the WCU Library Research Guides. If you log on to the WCU Library website, which is wcupa.edu/library, in the first part of that homepage for the library, there's a section where you can search, and there's a couple of tabs. The default one is OneSearch, but there's another tab called Research Guide, and you can browse those guides in order to find the Health Science Guide. Then under the Health Science Guide, you'll want to select the Statistics subject, and that will take you to the Statistics page. Then they have a number of tabs. The Health Statistics and the Global Health tabs are what I've found to be most helpful in finding data or other resources for health and global health statistics for other projects and other classes. So if we're on the Health Statistics tab in that WCU Library Guide, you can look up demographic information for Chester County, for other metro affiliate areas. You can also look at overall Pennsylvania state data. Policy Map is a really cool mapping system if you need to create a map for any reason. RAND State Statistics is super informative, and State and County Health Quick Facts I used a lot during my undergrad time and graduate time as well. The next resource, if you were scrolling down the page, is the CDC website, which they have different data access tools and other things, and we'll also be talking about some of them later in this presentation. And then there's Pennsylvania Health websites, Chester County, other county profiles, diabetes prevention and control, as well as a few other things are listed there. Another area you may want to look is the National Center for Health Statistics, or the NCHS. So this is through CDC. On the website I have linked here, cdc.gov/NCHS/data_access. They have public use data files as well as documentation for how that data was collected. And in some examples of the data they have freely available includes the National Health and Nutrition Examination Survey, a number of national healthcare surveys for healthcare administration needs, the National Vital Statistics System, the National Health Interview Survey, as well as longitudinal studies of aging, as well as others, but these are just a few I decided to highlight for you guys. If you're looking just for fast statistics, if you don't know much about a topic and you just need a refresher on something, you can go to the Fast Stats website. So it's through NCHS again on the CDC's websites. And here I took a screenshot of just a few things. They have topics listed alphabetically. Some are including adolescent health, asthma, birth, natality, immunization, kidney disease, mammographies, all kinds of things, as well as more. But this is a great place if you just need a quick overview. CDC Wonder is the CDC wide-ranging online data for epidemiologic research website, which is wonder.cdc.gov. And this is online data for research purposes. Some other purposes of this site include promoting information decision making by using up-to-date facts for public health practitioners as well as researchers. It helps aid us in research, decision making, priority setting, program evaluations. If you haven't taken that class already, you'll take a class about program evaluation, and this is a great place to go, as well as resource allocation. And it also provides the general public to specific and detailed information from CDC. So maybe this is a source you might want to refer people to if they want more information when you're giving a presentation. Some things you can do in CDC Wonder include creating tables, maps, charts. You can produce summary statistics, including frequency counts, rates, confidence intervals, standard error, percents, all these things we've talked about through the semester. You can organize data into different categories, compare different populations or locations or groups of people. And CDC actually has a quick start guide that I've linked here if you want more detailed information than I'm going to give you in this lecture. So if you go to that, they have much more detailed walkthroughs. So here's a screenshot of what the CDC Wonder website, when you first log on or go to it, what it looks like. So the first page is the Wonder systems. So there's a number of databases. You can use the AIDS public use data. There's a birth file, cancer statistics. There's a number of environmental databases, mortality databases, population-based databases, which includes sexual transmitted disease morbidity, vaccine events. Then there's some reports, which are prevention guidelines and other data and documentation files, and then some other query systems, such as Healthy People from 2010, and some morbidity and mortality weekly report review, morbidity and mortality tables. So we're mostly going to be focusing on the left hand column, the Wonder online databases. But if you wanted to see what else they had to offer by topic or in alphabetical order, you can click those other two tabs on this screen. So when we're using CDC Wonder, we can answer a number of different questions. So here I have the question, has the age-adjusted incidence rate of childhood cancer increased from 2003 to 2013 in the state of PA? So what we're going to do to answer this question is to go onto CDC Wonder and choose cancer statistics. Once they're there, there will be a tab that asks which we want to use. And we're going to have the cancer incidence 1992 to 2013. And we want to data request that. Now these are a number of options I have listed here of how I got the table that's shown on the bottom here. So we're going to organize the table layout in a number of ways. We want to group the results by childhood cancer and by year. That'll give us the column of showing comparing the years, the counts, and the rates. Then the measures we want to use, we want to have the age-adjusted rate as well as the 95% confidence interval. Otherwise, it will only give us a count, which would be the number out of the population. So if we want that age-adjusted rate, what I'm asking you in this question, you need to check that off in the measures portion. We're only looking in the state of PA, so we want to select Pennsylvania. We'll select the year and demographics. We're only going to select 2003 and 2013. You can do that by using the Shift key and clicking both those 2 years. Or it might be the Control key on your computer. Play around with that till you just get those 2 years selected. Then we're going to select the cancers of interest. In this case, we're looking at all the childhood cancers. And in other options, we're going to use the 2000 US Standard Million, which produces rates by 100,000, 1 million individuals based on how the 2000 population was distributed. Once we put all of those specifications in, we can send it, and it will produce a table. There's more information on the table than I have shown here, but this is the only information that we need to use to answer this question. So what we can see is that in 2003, the all childhood cancer age-adjusted rate was 183.3 per 100,000 or per 1 million individuals. And in 2013, the age-adjusted rate was 195.6. So yes, the age-adjusted incidence rate of childhood cancer has increased from 2003 to 2013 in Pennsylvania. Here's another example of using CDC Wonder. This is asking about chlamydia morbidity rate per 100,000 in Pennsylvania. We want to know if it is increased from 2004 to 2014 for both males and females who are aged 15 or older. So on our main CDC Wonder page, underneath the Wonder online databases, we're going to click the sexually transmitted disease morbidity database. Then we'll click the data request under 1996 to 2014. Then we'll come up to this page that shows how to organize your table layout. You want to group the results by disease, gender, and by year. So you'll have 3 different groupings, and that way when you get your table, it'll have the disease, then it'll be broken up by the gender, male and female, and then it will have the year, 2004 and 2014, for each gender listed for the disease of interest. We'll select our location, which is Pennsylvania. Then under select disease, age, etc., there's a number of other things listed. We're going to select the disease we're interested in, which is chlamydia. We're going to select the years 2004 and 2014. And then we're going to select the ages of 15 to 19 through 40 plus years. And that will include everyone who's 15 years of age or older. And then in other options, we want to calculate the rates per 100,000. It'll just give us a better number to compare. Then we'll press send, and we'll get the table that is at the bottom of this page. If you wanted to just see the rate per 100,000, there's a blue arrow to the left of that column header, and if you click that, and it will move to where the population column is, and if you click it again, it'll move to where the STD cases is. Then you would just see, it's just a little bit easier to read the rate per 100,000, but you don't need to do that. You can read it the same way as we'll read it now. So for females with chlamydia in the year 2004, the rate per 100,000 was 508.92. The rate in 2014 was 618.24. So that rate increased for females. In 2004, males had a rate of 209.65 per 100,000, and in 2014, they had a rate of 318.2 per 100,000. So we can see that males have a lower morbidity rate from chlamydia overall in both 2004 and 2014, but both females incident rate and male incident rates have, or morbidity rates, have increased from 2004 to 2014. But males are still at a lower rate than females are. Now we'll talk about the PA Bureau of Health Statistics and Research. The PA Department of Health has a number of data that can be analyzed to help solve some state problems. The website that this is under is statistics.health.pa.gov. I know that's a lot of words separated, but I have the link here. If you click on it, it will take you there. There's a number of different things if you are interested in learning more about from this website, or you want a refresher after this course is over and you're in the field. They have tools of the trade for public health and other health professionals, including statistical measurements, data analysis, charts and graphs, as well as collecting and data processing. And you can access those at the second link on this page, which is really long, so I'm not going to read it, but it is underneath the tools of the trade heading there. One of the main systems that is really useful on the PA Department of Health is called EDDI. This is the Enterprise Data Dissemination Informatics Exchange. It's an interactive health statistics tool that creates customized data tables and other graphs and charts and maps to help empower health professionals to use data and statistics to inform their policies and program decisions. It's really simple to use, and I think you're really going to like the program. It's clicking kind of like SPSS, only the data is stored in a warehouse, so you don't have to use it. You're just going through and selecting what information you want out of that. So it's a little bit easier. So the website for EDDI is doh.pa.gov/EDDIE. So to answer the question, which areas of PA had significantly higher or significantly lower percentages of not having health insurance for those aged 18 to 64 in the years 2013 through 2015. So we are looking to see which areas had lower than average rates of not having health insurance and those who had high rates of not having health insurance compared to the state average. So what we're going to do when we're on that EDDI website is select a group. So under that, you'll want to select all data sets. Then in the category column, you'll select BRFSS. Then in the next column is select a geography, and that would be, in this case, we're going to use the BRFSS region. And what that means is it's going to give us the regions that the Behavioral Risk Factor Surveillance Survey collects this information from. So it breaks down by some of the different counties, but it groups some counties that are less populated together. So for example, Chester County and Delaware County are separated, but Carbon, Lehigh, and Northampton County are pooled in one row, whereas Chester and Delaware County each have their own row. Philly also has its own row. So once we click the geography of the BRFSS region, we'll want to select a report. In this case, the only option is a table. So we're going to select table and then click next. We want the year 2013 to 2015. That's what our question asked. Our category would be healthcare access /coverage because we're looking to see what type we're looking to see about health insurance coverage in that year or in that time frame. For risk factor percent, we want to see no health insurance and age 18 to 64. So that's a specific option on the website. And then in demographic, we want to have all adults, age 18 to 64. For 5, we want the BRFSS region. So if you only wanted to compare your region that you're living in, so maybe you're working in Philadelphia, you want to compare Philadelphia to the overall state, you may only want to select Philadelphia from this list as opposed to selecting all of them. But in order to find out which areas had higher and lower percents of health insurance, not having access to health insurance, we want to have all of those regions selected. So we'll select all, and then we'll create table. Now when you create the table, it's not sorted in a way that would make it easy to find the highest and lowest. So in a similar way as you would do in Excel, you'll go over to the percent column and you will sort it from lowest to highest. So there's an arrow next to percent, a down arrow. If you click that, it will sort it from smallest to highest percents. If you notice at the bottom of the table, there's a note that unknowns are excluded from the calculation. Percents that are red for a region denote a significantly higher value to the state's percent, and a blue value denotes a significantly lower value than the state's percent. So we're looking for those significantly higher and lower, so we want to find the values that are blue and the values that are red. So now that we have it sorted, it's pretty easy to see the lowest region or significantly lower than the state average. In blue, it would be the 8% for Montgomery County. So Montgomery County had the most number of individuals, or the highest percent of individuals having health insurance, and the lowest percent of individuals not having health insurance for the whole state. And then we want to go down to the bottom of the list and find those individuals who had those regions that had the highest reported not having health care coverage insurance in that time frame. So if we look, we see that Philadelphia and the Adams, Franklin, Fulton County regions, those two groupings, both had significantly higher values compared to Pennsylvania's state average. So Philadelphia had 20% that did not have health insurance, and the Adams, Franklin, and Fulton County had 22% not having health insurance. So that's how we would answer this question. Another question we could answer using the Eddy system is this here by creating a map. So we want to know what county in Pennsylvania had the highest level of blood lead for children aged 3 to 6 who had lead poisoning in 2014. We want to have, this is asking for a map with 5 classes to identify the county with the highest levels. So if we go back to that Eddy request homepage, the group we'll want to select is all data sets. The category is the childhood lead poisoning. Geography would be county or state. The report would be a map, because we want to see a map, see a picture. Then we'll hit next. The next screen, we'll want to enter the year we're looking at, which is 2014. The age group, here we're looking for age 3 to 6. And in map settings, we want to show the table because we still want to see what the values are, even though the map is going to show us. We want optimal data classification, and we want 5 classes because that's what the question asked for. Your color palette and the transparency are optional. They have a couple of different colors. If you have a preference, you can use whatever color you want. I went with blue. I just liked the way it looked, but they have purple, I think, and red and green. So whatever color floats your boat, go for it. The transparency is just how much you can see the roads in the background of the map. So if you look outside, you can see some of New Jersey, how some of those roads are there, so you could make it more or less transparent. That's personal preference as well. Once you do that, you'll want to hit Create Map. And then you'll get this lovely map over here, and then the percent blood lead level is shown in the top right. It has that key of what the ranges are based on colors in the map. So the highest levels would be the darkest blue color. And it looks like here that Cambria and Juniata counties have the highest levels. But we want to see specifically which one county had the highest level. So now that we've identified that, we can go down to the table and look at percent level greater than, or total blood lead level greater than or equal to 10. And in Cambria, that would be, there were 15 out of a total of, I think, 237. If you look at the next column, it gives the percent. And then in Juniata County, there were 2 out of 28, which is 7.1%. So here you can see that Cambria had the highest levels of blood lead levels greater than or equal to 10. So that's how you would answer that question. This last example using EDDI is creating a chart. So it's a graphical representation comparing the percent of individuals who are born with a low birth weight in Chester County and Philadelphia County, as well as all of Pennsylvania, the average for Pennsylvania, from 1990 to present. So this is looking at a trend, a time trend over the past 25 years, because I think the most up-to-date they have is 2015. So from 1990 to 2015, we were looking at the trends over time of low birth weight in these 3 groupings. So there should be a line for Chester County, a line for Philadelphia County, and a line for the PA average. So in groups, so we're back at that EDDI homepage again. We're going to go to all data sets. The category would be births. Geography would be county, state, because we're looking at counties. And the report type would be a chart. Then you'd hit next. Then we would want to find in the next page that pops up, we would check off the counties, Chester, Philadelphia, and then all of PA. The year, we would select one and select all of the years. So we're choosing each year individually instead of summarizing a couple of years at a time and then selecting all of them. Like we did in the table, it was summarizing the years 2013 to 2015. This, we want each year to have its own data point. We want all races represented, but if you were interested in a specific race for your area location, you could check different races off there. You could want the rate or percent. We want the percent low birth rate. We're not including the very low birth rate here because we just want to know those who had a low birth weight, and it won't allow us to create one table with the 2 of those combined. So we're just going to look at low birth rate. And then the age, we want all ages there. I believe that is the age of the mother, so we're not concerned about that right now. But if you wanted to compare younger mothers compared to older mothers or something of that nature, you could select different age groups. The chart type, we want a trend line, which will show each point and how it varies by year, and then we'll create our chart. When you create the chart, you'll get a picture that looks similar to what's on the right side. So it has a title, the Pennsylvania Births Percent Low Birth Weight. We're using all races, all ages, and it gives you the date that you created this. On the left-hand side, we have the percent of individuals in that county or the state average. Across the bottom is each year. And then the different colors, yellow is for Pennsylvania overall, red is for Chester County, and pink is for Philadelphia County. So if we look at the graph, the pink line is at the top, so it shows the highest rates, and it is higher than the Pennsylvania state average. So, but we can see that from 1990 to present, that rate has gone, it's kind of been up and down, but right now it is lower than what it was in 1990. Well, in 2015 it was lower. So in 1990 it was probably about 11.5%, I'm gonna average there. And now it's probably down around 10.7, 10.5%. And there is a table that gives you exact percents if you check that off as well, but I didn't include that on the slide. For Pennsylvania overall, the rate has increased from 1990 to present. So in 1990, the average was about 7, and now in 2015, the average is just a little bit above 8% of births. For Chester County, the red line, we see that it's lower than the state average, but again, this average has increased over time. So in 1990, this Chester County's average was about 5% of births, and now in 2015, the average is closer to 7%. So if we were looking to see where we might put a program to help inform the public about low birth weights, would we want to choose Philadelphia County, or would we want to choose Chester County? Well, maybe Philadelphia County has put something into place, because from 2011 to 2015, the rate has gone down, whereas in Chester County, from 2011 to 2015, the rate has stayed about the same and gone up slightly. So if we're looking at decreasing the rate, it would probably be more effective to decrease the rate in Chester County. Although if we want to see if we want to reduce the rate of a county overall to help be closer or below the state average, then we would still want to have another program or redo or readjust the program in Philadelphia County. So you could have many answers to the question, which program would you target? But if you put your reasoning behind that, I would understand and count it towards that. So that's all I have for you. If you have questions about these systems, please let me know. I think they're fairly simple to work through, but I'm happy to help if you need them. So this will help you with homework 10. You do not need SPSS for homework 10. Good luck, everyone.